Dear researchers, scholars, and the students, I welcome you at Advanced Multiple YouTube channel. Advanced Multiple Incorporation actually a knowledge professing and information management organization that is located in Mississauga, Ontario, Canada. My name is Dr. Taha Nazir. I'm working as scientific executive with Intellectual Consortium of Drug Discovery and Technology Development. Both of these organizations actually located in Mississauga, Ontario, Canada. Okay, well, I'm going to share my information, my knowledge, and my research under the title of Microbial Contamination of Susceptible Pharmaceutical Dosage Form. It means different pharmaceutical dosage forms that are susceptible to for microbial contamination. We are going to discuss or talk about that. For this purpose, I collected information from different data sources like PubMed, Medline, Scoopers, Google Scholar, National Library of Medicine, MBEST, DACTIA, Open Access Journal, ProQuest, China National Knowledge Infrastructure, and some information collected from ResearchGate and Crossref. Okay, well, before moving forward, I would like to talk a little bit about microbial spoilage. Microbial spoilage actually is the damage of pharmaceutical product caused by the microorganism. Microorganism can grow in almost all kind of products. They exist everywhere around us, around the world. Pseudomonas species, yeast, and mold can also spoil most of the food items too. High fat content and low water activity make products more susceptible for the growth of microorganisms. There are the 14 different kind of the pharmaceutical dosage form that are susceptible for the microbial spoilage or microbial contamination. Liquid and semi-liquid. Second one is ophthalmic preparation used for the complication of the eyes or the treatment of different pathological disorders in the eyes. Irrigating and dialysis solution that is used for the washing of the lesion and in surgery. Injectable and infusion, suspension, emulsion, cream and lotions, ointment and oils, syrup, tincture and elixirs, solid dosage forms, powder, tablet and lozenges. Okay, first one is the liquid and semi-liquid dosage forms. Water is a major constituent of most of the liquid pharmaceutical preparation. Bacteria required high concentration of water for growth in their immediate environment. All products containing large amount of free water can be partially susceptible to spoilage by bacteria such as gram-negative or gram-positive bacteria. Subsequently, a wide variety of the bacteria, mold, and yeast can contaminate distilled water in pharmaceutical preparation. Okay, well, ophthalmic preparation, the pharmaceutical dosage form that is used in eyes. The organism Pseudomonas aeruginosa produce corneal ulcer along with many ophthalmic infection causing blindness from the use of saline solution contaminated with the Pseudomonas aeruginosa during intraocular operation. Eye infection also occur from the use of eye drop contaminated with the species of aerobic aeruginosa. Infection arising from contaminated batch of neomycin. Neomycin is an aminoglycoside drug, antibiotic drug that is used in infection in the eyes. Irrigating fluid and dialysis fluid. Pseudomonas infection occur from contaminating urinary catheter. Hemodialysis present a particular problem, septicemia from dialysis fluid contaminated with Pseudomonas aeruginosa, and bacteremia due to Bacillus cereus contaminated or contamination of the dialysis fluid. Fourth one is injectable or infusions. Undoubtedly, the most serious infection outbreak are associated with contaminated injectable fluids, where bacteremic shock and in some cases death of patient may result. Infection arising from glucose saline solution contaminated with penicillium species. Preparation of the total parenteral nutrition may cause death due to the contamination of the organism Enterobacter cloacae. Okay, well, fifth one is suspension. Aqueous suspension of inorganic material frequently support microbial growth, particularly when added preservative are inactivated, unless growth is at the surface. As the mold contaminant, it is not easily detected visually because the opacity of these products or the containers. When the lid is removed, spoilage is sometimes manifested by the offensive odor and unpleasant taste, decolorization of or change in color. The sixth pharmaceutical dosage form that is susceptible to microbial spoilage or microbial contamination are the emulsions. Emulsion, like oil and water emulsion, are particularly susceptible to spoilage as the water is in the continuous phase, allow contamination to spread throughout the product. Preservatives generally exert their influence by only within this phase and at its boundaries, but their concentration depend on their relative solubility in particular oil and in water, and oil and water ratio in emulsion. In addition to partition effect, the activity of the preservative may be further diminished due to inactivation by compound such as non-ionic emulsion. Spoilage in emulsion can be manifested by change in rheology or rheological property including separation of phase, breaking, cracking, discoloration, decolorization, change in odor and taste, and sign of visible growth of microbial colonies or the fungal colonies. The seventh pharmaceutical dosage form that's susceptible for the microbial growth or microbial contamination are the creams and lotions. Spoiled cream may feel lumpy or the gritty. Glycerol is commonly used in pharmaceutical and may be metabolized by organisms frequently found in water. For instance, Klebsiella species will frequently produce gas in poorly preserved product and cream and lotions. Mold growth is one of the most common cause of spoilage of cream and R-type, and can also occur in products such as antifungal calamine lotion. Okay, well, the eighth pharmaceutical dosage form that is susceptible of microbial growth is ointment and oils. As these are anhydrous material, in theory, they do not support the growth of microorganisms. However, they participate in when often filled into jar or other container with large air space, as this introduced the possibility of the mold spoilage because these organisms can utilize atmospheric moisture. For example, mold colonies on the surface of ointment include white petroleum jelly. Oils are at a slightly greater risk than ointments, as being more fluid, they allow condensed water to carry organism to the bottom of the container and the remain trapped. This ninth pharmaceutical dosage form that is susceptible of microbial growth are syrups. The sugar content of the syrup inhibit the growth of many microorganisms by virtue of its high osmotic pressure, but osmotolerant mold and the yeast are a source of trouble. Fermentation of the sugar by these organisms cause foul flavor due to the production of alcohol, lactic acid, and other organic acid, while the production of the carbon dioxide lead to gassing. In addition to the product including syrup, British pharmacopoeia, and various syrup containing cough remedies can be spoiled. Okay, well, the 10th pharmaceutical dosage form susceptible of microbial spoilage are the tinctures, elixirs, and the linctuses. In general, these formulations do not allow microbial survival because of their high concentration of alcohol, sugar, and glycerol. For instance, even concentration as low as 5% alcohol will kill most bacteria and mold, while yeast are generally killed all concentration above 15%. 11 dosage form susceptible of microbial growth are solid dosage forms. For example, the raw material. Solid raw material may serve as a source of contaminant, which will later spoil a formulated product. Natural earth, such as a choline and bentonite, are particularly susceptible. Solids of biological origin, for example, egg and milk product, and dried animal and plant extracts may also contain pathogens, including Salmonella E. coli, Escherichia coli, and Staphylococci. Spoilage of solid raw material itself is largely due to mold growth. The 12th dosage form or 12 ingredients or active material that is susceptible for the microbial growth are powder. Spoilage of product in powder forms due to visible mold growth also occur under damp condition. Okay, well, 30th dosage form, that is most frequently dosage form are tablet. The major advantage of tablet as a dosage form is that they provide an accurate dosage of activity or active substance. Each tablet must contain a known amount of the drug and excipient. Lactose is one of the most used excipient in tablet. It is originally white in color, and most of the tablet turn brown when 1 week incubation when contaminated with the microorganism. The literature also report other change after microbial contamination, including crack at the side and rough surface. Color change are physical manifestation of chemical alteration of the tablet components, such as starch of the microorganism. This lead to a loss of binding properties and manifested as crack. The tablets also become softer. This may be due to breakdown of the starch used as a binder. The organism transform it into nutrient for growth from it. The disintegration time increase significantly with time after incubation with the organism of storage. The literature report that this effect is due to Aspergillus species. Okay, well, this is the last dosage form, pharmaceutical dosage form that is susceptible of microbial spoilage. Is lozenges. The lozenges, visible spoilage of tablet, generally manifested as surface discoloration, may be caused by the growth of the mold. Spores from the environments or the container may find sufficient moisture to initiate growth on the tablet surface, even under apparent dry condition. Okay, well, in conclusion, exposed microorganisms may contribute to the development of the microbial contamination of susceptible pharmaceutical dosage form. Highly efficient hygienic measures should be introduced in industry, hospital, and facility to prevent pollution and subsequent secondary emission of the microbial contaminants. The limited microbial contamination is criteria for the control of pharmaceutical dosage form. Before closing, I would like to salutate and greet to my friends, my colleague, and my co-worker, Sherry Bajkat, Wolfgang, Daniel, Dustin Hacker, Marwa Al-Maghribi, then Robert Heyman, Hunza, Noreen, Faisal, Tarimil, Ishtiaq, Arslan, and Amin. I would like to acknowledge the kind help and support of Advanced Multiple Incorporation and Intellectual Consortium of Drug Discovery and Technology Development Incorporation. Thank you very much for staying with me and watching the video for so long time. See you soon in my next video. Take care for now. Bye.